So this would just be information about their candidate drugs that they think that could be applied to biliary conditions or various other medical conditions. Even that is behind a paywall. Yeah, and speaking of research to benefit public health, wouldn't it be great if there were no paywalls when we're trying to find these studies? I think that's another one of our rats scenarios where we're like reading an interesting study and we discover that it was done in a mouse model. And then another one is we see an interesting headline, an interesting study cited, and then we go try to actually see the full text of that. And then it is behind a paywall. And that's another scenario where we say rats.
Yeah, certainly so. One thing that I found that was particularly malignant, pun intended, by the way, because this was studying PPAR delta agonists. One of the good things about GSK, which is GlaxoSmithKline, is that they appear to be the only company that wants to touch funding research on new PPAR delta agonists, largely for biliary disorders. But when I looked into their program, you can go to look up various programs that fund multiple different research studies. Even the information behind the program, which was not in an academic journal, but that was also behind a different paywall.
So this would just be information about their candidate drugs that they think that could be applied to biliary conditions or various other medical conditions. Even that is behind a paywall. They don't want people to be able to access that, or they, I imagine, want to make some money if people are going to access that information.
Yeah, and it's not a journal, so it can't be found on something that starts with sci and then ends in bub. So anyway, we mentioned the legislation that was introduced to remove paywalls. Previously, we've discussed journals like Curious. I think that's mostly an open access journal. But from a 1,000-foot view, yes, we definitely want there to be less restricted information. And the fact of the matter is, when you publish in a journal, and there are several studies that we want to publish in journals in a variety of different fields, but whenever we do, we're basically making the choice: do we pay $2,000, $3,000, $5,000 in order to publish this without a paywall, or do you just publish it with a paywall?
Yeah, and then the other topic that you brought up here is that the authors of that paper, they are allowed to send you that paper for free when it's requested. So let's say that Kyle and I published a paper in Nature. Yeah, it's an okay journal.
Yeah.
I imagine there's quite a sizable fee there to get that open access.
Yeah.
But if someone said, hey, I'd really like to read your guys' paper that you published on, trends in fill in the blank, then we could send that paper to that person. And I've tried this on occasion. You find people on Twitter, or there's a corresponding email there, and it's essentially a coin flip whether I hear back from that person or not. So it's a loophole of sorts, but it's not a very effective one, because it's going to depend on, maybe this person is retired at this point. They published a paper 20 years ago, and we can't see that. That person is not going to be in their retirement trying to, drum up interest in this paper and then sending it out to people.
Yeah, that's a good point. One other point on papers. One thing that we both particularly love about academic journals is the ability to submit a letter to the editor. It's a commentary article, if you will, and it's published in usually a subsequent journal. And occasionally you'll have back and forths. There was one of these back and forths on one of the new PPAR delta agonists. And I think of it as an equivalent to the YouTube comments section, but among scientists and clinicians. So I wish that was taken advantage of more often.
Yeah, when we were looking at this the other day, an example, and it was a gastroenterology journal, I believe, or hepatology perhaps, but it reminded me a bit of Twitter, except a much more elaborate back and forth in the Twitter or med Twitter comments section. And it's done like with some formality to it. So it's like, oh, thank you for thank you for your critique of this. But in reality, is that person actually thankful that their article got critiqued? Probably not, but it's like a work email chain, right? Everything is very, very much formal and polite to each other. It's a nice format to have that sort of a discussion.
We appreciate your thoughtful and useful critique of our work.
Yeah. Be like,
Now we will proceed to dumpster you
Or-
in the subsequent paragraph.
or as previously discussed, or like in case you didn't actually read my paper.
As mentioned in the paper.
Yeah.